and welcome. Thank you everyone for joining us today. This webinar series is for dairy producers and veterinarians that would like to get more value out of their relationship with CentralStar. So the first 30 minutes will be a presentation, but feel free to type questions in the chat along the way. Once the presentation portion is over, we'll open the floor for additional questions and discussion. Don't be shy. You joined us because you want to know more, and we want to give you the information that you need. So in today's episode, don't settle for no growth results. We will teach you when to use PCR or culture to guide practical management decisions, how PCR gives more than no growth results, how to make targeted treatment decisions that save you time and money, and more. So the goal is for you to appreciate the simplicity and value of implementing mastitis PCR testing in your herd to improve and maintain milk quality. So let's get started with a few introductions. I'm Michelle Kaufman, the Customer Solutions Advisor for CentralStar Cooperative. I consult with producers to design testing strategies and implement results into real-world management decisions. To help us better understand the use of mastitis PCR, I have two speakers from Thermo Fisher Scientific. Dr. Ivan Leva-Baca is the lead product manager of the notifiable diseases portfolio. Dr. Leva has over 11 years of animal health and genomics research experience with emphasis in product development for molecular diagnostics. He will be helping answer your questions after the presentation portion. Dr. Lee Barton is the Senior Product Manager for the ruminant portfolio. Prior to joining Thermo Fisher, Dr. Barton was a large animal product manager in the pharmaceutical industry focused on the prescription veterinary medicine portfolio. She will be doing the main presentation for us today. So thank you both for taking the time to join us and teach us, and now I turn it over to you.
Thank you, Michelle, and happy to be here. Hello, everybody. Hope you can hear me okay.
Sounds great.
Perfect. Right, I am going to share my screen now, and hopefully can you see the screen?
Absolutely.
Fantastic. Well, hello everybody and welcome to today's presentation. My name, as Michelle has kindly introduced me, is Dr. Lee Barton and I work for Thermo Fisher Scientific, and today I'm going to be talking to you about mastitis PCR. Very brief overview of the agenda. We're going to go through some of the basics of PCR, what it is, how it can be used, and why it's useful for mastitis in particular. What are the advantages of PCR and how you as producers can utilise the important information that it can provide. Michelle's already told you a little bit about me, but to make sure you know who you're talking to, as we've said, my name is Lee Barton. I studied bioveterinary science at the University of Liverpool. Before doing my PhD in veterinary microbiology, I actually did this in the area of digital dermatitis in cattle and sheep for any foot enthusiasts. And I then worked for some time in animal nutrition before working in the pharmaceutical industry. And now I am a product manager at Thermo Fisher Scientific. But a bit about who Thermo Fisher are and what we do. So we're a diagnostics company. And part of Thermo Fisher is a brand called Applied Biosystems, which is where our animal health diagnostics sit. Now, we've been producing diagnostic products for a long time, over many years, as you can see by the diagram on the slide. And what I really wanted to show was that we've always had a long focus on ruminant diagnostic solutions. So anything from TB to BVD, BTV, foot and mouth, T fetus, and mastitis. Now, I'm not going to go into a huge amount of depth about what mastitis is, because we all know that mastitis is inflammation of the mammary gland, mostly caused by pathogenic agents introduced during the milking process or environmental contact. There is a long list of pathogens that can cause mastitis, as you can see by the list there. And that's probably one of the reasons why mastitis continues to be one of the most frequently occurring bovine diseases. Now, we tend to split these pathogens that cause mastitis into two different subsets, contagious and environmental. It's pretty much what it says on the tin. Contagious, the dairy cow's the host, so it's from cow to cow in usually milking procedures. Environmental is from obviously the environment, and generally examples of these pathogens, we're thinking of contagious, so your Staph aureus, highly contagious pathogen, and then environmental, E. coli, Strep uberus, yeast, etc. A little bit on the economics, just to really showcase why it is important that we understand exactly what causes mastitis. It's because it's a very costly thing to the global dairy industry and certainly the US. Even a subclinical case is costing up to $100 per case, and clinical cases anywhere between $250 and $500. Now, if we can ultimately find the reason for the mastitis and do what we can to reduce and eliminate that, obviously we're going to be aiming to bring down those costs. Now we are into where PCR might fit into this. But what is PCR? Well, we'll come on to exactly how PCR works in a moment, but what I really wanted to show you here is PCR has been used for a long time, and it is a well-established, proven technology. We use it in lots of different applications, anything from DNA profiling to medicine to phylogeny. The list goes on, but it also has a lot of uses in animal health. For example, routine disease monitoring, outbreak situations, screening for animal transport. And the reason it's used is because it's a highly sensitive piece of technology, which is going to allow pathogen detection quicker, potentially before clinical signs are seen, which is going to allow for faster action, which ultimately can maintain herd health. But how does it actually work? So briefly, real-time PCR uses essentially the same components as traditional PCR, such as DNA or RNA as the target molecule, specifically designed primers and probes that can anneal to the specific pathogen of interest. And then we go through a series of heating and cooling in a thermocycler, which causes that DNA or RNA to anneal and multiply. So that's our amplification cycles. As that amplification proceeds, we'll see fluorescence increase. So that's the real difference with our real-time PCR. We're looking at it in real time because we're going to be putting in our fluorescent marker into the mix. The real-time instrument will record that increase in fluorescence as the amplification goes on, so the increase in number of DNA. And that can be measured as a CT value to show whether the target is actually present in the sample. So the lower the CT, actually the more pathogen was in the sample initially, because the CT value is the threshold cycle, which is basically how many cycles it's going to take for the fluorescence of the DNA target to be above background signal. So the lower amount of cycles it takes, the initial amount of obviously our target DNA was in that sample initially. But there are a wide variety of mastitis testing options. Obviously, we have our somatic cell counts, which are going to be a quick and cheap way of estimating the number, obviously, of white blood cells that are in the milk. There's also bacterial culture, which obviously has been widely used for some time. We'll go through some of the positives and negatives of these in a little while. And then we come obviously on to PCR for mastitis in particular. And this is going to provide a fast, specific and very sensitive way of being able to identify mastitis pathogens. So PCR can detect many more pathogens per sample and more minor pathogens compared to culture. And what it also can do, and do this very well, is obviously the pathogens that it is going to be picking up, they don't have to be dead or alive. So we can really get a history of infection rather than only being able to pick up live bacteria. And we'll come on to more about the exact benefits in a moment, but it's going to be a quicker time to results. So firstly, one of the big advantages of using PCR in mastitis pathogen identification is convenience. PCR can use a multitude of different sample types. We can be using bulk milk, preserved milk, frozen milk, and your DHI samples, meaning that you're not having to take an extra sample to do any mastitis testing, which inevitably means less time and extra labour. And you're going to get a huge amount of information from that one sample. Also, there are pooling options. So if we wanted a more economical approach, PCR is sensitive enough to be able to pool up to around 5 samples, and we can still pick up that target pathogen DNA, which makes it a very convenient way of being able to test for mastitis pathogens. Time to results. So this is a huge factor which makes PCR a very good option, not only for just identifying pathogens, because it's always preferable to obviously have a faster diagnosis, but it is particularly relevant when it comes to certain mastitis pathogens. So M. bovis, for example, as we know, it's extremely difficult to culture, and it can take up to 10 days to incubate. And after the 10 days, we may have obviously certain situations where we still get a no growth result. However, obviously with PCR, you've got the potential for identification within 48 hours, which means that you can act fast and make appropriate treatment and management decisions based on that result. As I've just said regarding obviously the no growth aspect, 40% of clinical mastitis milk samples come back as no growth. And when it comes to M. bovis, this is obviously something that we need to take into consideration. And it may be that PCR, given its fast turnaround time and ability to successfully pick up M. bovis without being hindered by contaminating organisms, is a very good option. A little bit about species identification. So sometimes it can be extremely important to not only know exactly how much of a pathogen is in a sample, but it's also very important to know exactly which species is going to be causing the mastitis. And one of the reasons for that is because if we're going to be treating with antibiotics, we're going to have differing cure rates for these different species. So it will definitely play a part in our decision-making process, whether it's going to be worthwhile, if it's going to be a cost that is basically pointless. And so finding out what species is exactly causing the mastitis is extremely important. For example, if we take Staph aureus, we're going to see low to moderate cure rates, most likely. So it might be in that situation, if we find out it's Staph aureus, we make a different decision when it comes to treatment options versus if we find out it's another species of strep with a much higher cure rate. And knowing pathogen load can be critical. So obviously with culture, it is possible that sometimes some pathogens will grow large colonies and then dominate the dish. And that can then prohibit the growth of other pathogens. And sometimes those fast growing pathogens aren't necessarily the most important or the ones that we need to be targeting. PCR will give us the whole picture. And it has been shown that mixed infections of 2 or more mastitis pathogens have been detected more commonly by PCR than conventional culture. Now, PCR and culture both have their place when it comes to mastitis pathogen identification. But PCR is going to have a shorter time to results. We're talking 48 hours, even for detection of up to 15 different pathogens. We can also obviously have the convenience of using DHI samples. And another key thing is we can use PCR in cows that are already being treated. We're still, PCR is highly sensitive, and so we're still going to be able to be picking up those small amounts of DNA that are going to be shed in cows that are already being treated with antibiotics. However, PCR can be more expensive, and so that is a trade-off for the amount of information that we're going to get. However, as we've said, there are economically appropriate decisions that can be made there, whether pooling might be a better option, and if we're going to be following perhaps bulk milk over a long period of time. And as we said about culture, it can be obviously a cheaper, more economic option in certain cases, but we have to consider that in a lot of cases, we may be getting the no growth results. Mastitis treatment. So I won't try and go into all of the different treatments of mastitis, but what I really wanted to show here is that we have so many different pathogens at play in mastitis, all with a different classification. Some will be contagious, some will be environmental, which without knowing, obviously we can't make management decisions at that point. Some are going to be gram positive, some are going to be gram negative. All of these factors will influence what treatment option that we are going to look at, the length of treatment, or whether actually there's no treatment at all. And maybe it's a management factor that needs to be looked at. But again, fundamentally, we need to be understanding exactly what pathogens are at play in the mastitis issue to even start making, obviously, an appropriate mastitis treatment plan. And as I've said, obviously different categories of pathogens will require different management strategies, but it's really important that we find the correct pathogen identification, and then we know whether even an antibiotic will be effective, if it's even appropriate. PCR can provide that information, and it can provide it fast. And some examples of how perhaps it will influence our decision-making process. If we get a positive back for E. coli, we may have the treatment protocol changed or even stopped, because we're now understanding it is a contamination, potentially contamination issue. It's a environmental factor. Or on the flip side, if we find we have a chronic Staph aureus infection, we might have the treatment protocol extended, or even make the decision to obviously have the infected animal culled, because we may at that point, based on the wider information, for example, history of cure rates in those particular cases, we might make the decision that actually we now know it's Staph aureus. Treating may not be actually the most beneficial and certainly economic thing to do there. Now, potential management changes that obviously can arise once we have this large information from PCR. Now, we can do obviously lots of things, from culling chronic mastitis cases. Once we again know, for example, it might be that we've got a Staph aureus problem, or it might be that we look into different biosecurity measures, segregation, grouping, these type of things. But all of this will depend on obviously identifying the mastitis-causing agent. And one of the other things, obviously, is using antibiotic dry cow treatment for infected cows at the end of lactation. And selective dry cow therapy plays into this. And I really want to now just cover selective dry cow therapy very quickly towards the end of the presentation, really just to try and explain how PCR can potentially fit into a dry cow therapy protocol. So blanket dry cow therapy was banned in the Netherlands about 10 years ago now, and it has been very successful, their selective dry cow therapy regime. In fact, they've reduced their antibiotic usage by around 63%. Now, how they use this protocol is basically if a cow is deemed eligible for antibiotics based on somatic cell count, producers then obviously determine which antibiotic is appropriate. Now, identifying the infected pathogen can play a significant role in determining which antibiotic you're then going to obviously use in your selective dry cow therapy protocol. PCR testing can be a fast, efficient, accurate way of determining that pathogen type, especially knowing whether it's a gram-positive or gram-negative problem, and then we can make an appropriate choice on antibiotics. Then the next stage can obviously go on to antibiotic resistance testing to ensure that first choice antibiotic is actually going to be effective, and if not, we move on to another choice of antibiotic. So really, with selective dry cow therapy, we need quite a holistic approach. We really need to know the whole picture, and we're using different techniques to ensure that we're really going to drop that antibiotic usage where it's not necessary. Now, you can obviously use other techniques in selective dry cow therapy, so obviously culture, for example. But a downside of this is if you're going to use culture, obviously, to determine whether or not you're going to be administering antibiotics, if you are going to be getting that no growth result, we have to be very careful, obviously, within our protocol for that, given that that might not necessarily be a good representation of exactly what's going on in the herd at that time. If it is a genuine no growth result where there still though is a mastitis problem and it's perhaps just not picking up the problem, for example with bovis. And obviously somatic cell counts can also play a part in selective dry cow therapy, but again somatic cell count alone, we have to be careful on its interpretation. Other things may be playing a factor within that somatic cell count. Cows that are getting to third lactation, there may be other factors that are increasing that somatic cell count. And so what PCR provides is a wider picture of what is actually going on and can really be the first step in selective dry cow therapy to understand whether our first choice antibiotic is going to be likely to work based on obviously it being gram-positive or gram-negative bacteria. And then we can move on to the next step, which is ascertaining whether the bacteria are resistant to certain antibiotics. A very brief summary, but an important one. There's many bacterial species that can be involved in mastitis, and what that means is it's very important that we understand exactly what pathogen is playing a part in that specific mastitis case. It can delay treatment intervals, and also we can be using treatments that aren't going to be effective because we maybe don't know the full information around what's happening in that particular mastitis case. And as I've said, we have to be careful, obviously, with culture just because of the issues with no growth. So PCR really enables us to act fast and identify a larger amount of mastitis-causing pathogens. As I've said, it's extremely convenient. We can be utilising samples that we're already taking. We're not having to take extra samples, taking up time, labour, and fundamentally cost. And we're able to be detecting clinical and subclinical mastitis, and can still be used obviously in animals that are undergoing treatment, and it'll give us that history of disease. Some mastitis pathogens, it's extremely important that they are detected early, whether that be bovis or Staph aureus. And so PCR can really form an important part of a mastitis identification protocol to ensure we know what's going on and we can then treat accordingly. And finally, just a thank you for all listening. And I hope I've given you a quick overview of how PCR works and how it can fit into mastitis pathogen identification.
Wonderful. Thank you, Dr. Barton.
No problem.
We're going to open it up for questions, and I see I have one in the chat already. Dr. Yvonne did throw out an answer, but I just want to read it to everybody that maybe is not able to see the chat and the answer, and then see if we have anything else we want to contribute to that. So his question was, this is from Rex, this is one of our sales managers here at CentralStar. He asked, how do you justify the cost of PCR compared to a culture test? How can I justify this cost to my dairyman when it comes time to pay for the testing? And so we did get a response from Dr. Yvonne, who said, hi Rex, thank you for the question. There is a well-known risk of roughly 40% of cultured samples do not grow. There is a high risk of false negatives. PCR will improve sensitivity and specificity that will minimize the risk of false negative results. I just wanted to see if there's anything else we wanted to add to that before we move on to any other questions.
Well, just very briefly as well, as Yvonne said perfectly, yeah, you're not going to obviously experience the issues with culture where you get the no growth result, which is obviously frustrating at times and can mean perhaps the cost benefit there isn't quite what we would like it to be. And also we can look at other options. We did say obviously about pooling, so that can fit into a scenario where we want a more economic testing solution. And also we're getting a huge amount of information from that one sample. You know, we can be testing up to 15 different pathogens within there. And that having that whole picture obviously takes a lot of interpretation. However, it can really long-term be saving time, cost and money and ensuring that we're using the right treatment for the right pathogen.
Thank you. Another area I see this utilized a lot, or some of the ways that I like to tell people about this, is that also we're able to find the pathogen even after the cow has already done her job fighting it off, where you may not find that in culture. And so then it gives you a good picture of what caused the issue to begin with, and you can go back and try and figure out what happened and what you can do to prevent it from happening again.
So true, Michelle. You know, that is a massive benefit of PCR, is obviously as a cow has mastitis, like with any infection, that immune response is going to be trying to clear that pathogen load. But PCR is sensitive enough that we can still be detecting down to very, very small numbers of DNA. So as you've said, it means that even if she's started to, or even pretty much cleared that infection, we still know what's caused it. And it means that next time we can act on it, whether at that point or we know exactly what's going on in the wider context. So yeah, completely.
Great. All right, I'm gonna open it up and see if anybody else has any other questions. Feel free to unmute yourself if you'd like to talk, or you can type them in the chat and I can read them out for you. All right, looks like we have another one in the chat from Kelsey. It says, specifically, I wonder what you think about the risk of contamination of the samples by pathogens common on our skin and the surfaces of the skin of these animals, such as Staph aureus and staph species.
Yep, so obviously it is a risk with any sample taking, is the risk of contamination. And that does mean that when we have PCR results, we have to interpret them with a wider context. Obviously, we do a lot of things to minimize contamination, whether that be when the sample's being taken or even when they get to the lab. Certain protocols are in place to minimize contamination. But it is always a risk. And that's why in these certain scenarios, if we are doing multiple PCR tests, we can really see over time if suddenly there is an unusual change, or we know what certain pathogens are usually detected. we can understand a little bit more whether there may be a contamination issue or not. I don't know, Yvonne, if you want to add anything to that.
No, I think that's a very good answer. So nothing else to add there.
Another question I had to kind of go along with that and might even help answer it is, so our lab, when we run a PCR test, we report the CT value that we found for each specific pathogen. You kind of talked a little bit about CT values when you explained how PCR works, but can you tell us a little bit more about how people may be able to use that value to help interpret those results?
Yep, so CT value is obviously stands for cycle threshold. So it's the amount of cycles it's going to take for the fluorescence of the target DNA to go over background. Now, that is inversely proportionate, basically, to the amount of DNA which is in the sample. So that CT value is directly correlated with the amount of DNA in that sample. So we can look at that over time. You know, if we're seeing peaks, troughs, that's one of the good things about PCR is you're getting a definitive number which is directly correlated to the amount of DNA which was in that initial sample.
Great, thank you. All right, looks like I've got some more in here from Tony. He says, hey Lee, could you please put some numbers on how much better PCR is compared to culture on no growth samples except M. bovis? So it sounds like excluding M. bovis. If we have
so the 40 to 50% isn't just M. bovis. So that 40 to 50% is across the board for clinical mastitis samples. So regardless of the exact type of pathogen that's involved, that is an average number based on clinical samples coming in with mastitis that we know do contain certain pathogens that unfortunately have still shown a no-growth result on culture. So apologies, I should have been a bit clearer on that. That's actually that was an average across the board for mastitis-causing pathogens.
Correct. Mm-hmm.
Perfect. Thank you. I've got another question here from Justin. Says, can PCR testing be used alone for selective dry cow therapy?
Mastitis is obviously a very complex disease and can be caused by a multitude of pathogens. And with selective dry cow therapy, it's important that we know exactly what's going on within that herd. So PCR is perfect for giving that big picture and knowing whether we're dealing with a gram-positive or gram-negative problem. And then obviously that's then going to allow us to make the appropriate antibiotic treatment option. However, what it's not going to provide is obviously that antibiotic susceptibility testing. So we're not going to understand, although say we have a certain pathogen identified and then therefore we are going to use a first line antibiotic that will be appropriate for that certain pathogen. However, what we don't know from PCR is obviously if there's resistance though within that bacteria to that antibiotic, which is why it's then necessary to look into antibiotic resistance testing to ensure that that antibiotic is actually going to be effective in that particular bacterial case.
Wonderful. Thank you.
Another point regarding selective dry cow, it's in some European countries, the way that they go for it is at the moment of drying off, before drying off, I think they take a sample and they use somatic cell scores to determine, and they set up a threshold, right? And they determine, if that animal requires a treatment or not. And, there's been for years calculations on the correlation of somatic cell scores with mastitis. And there's only a 70% correlation. So it means that there's 30% chances of not being able to properly identify if that animal is going through mastitis or not. With PCR, we believe that you can potentialize your management because it's gonna tell you if the presence or absence of a pathogen there, right? So it's gonna give you a better answer. And I think what Lee explained as a second stage, like the sensitivity, it's actually gonna be better, right? So PCR by itself is gonna increase the chances of success for selective dry cow, But if you go a step further with sensitivity analysis, I think you're going to be even more successful.
Yeah, absolutely.
Justin did have a follow-up question that I can field this one. He asked the ballpark cost of PCR testing per sample. So here at CentralStar, we have a lot of different testing options available, a few different types of panels we can do, some pooling strategies. So you could be looking at anywhere from $4 to $40 per sample, just depending on what kind of strategy we use. And so that's something we'd want to work with you closely to figure out which is the best option for what you're trying to get out of the information. I've got another question in here from Tony. Says, can I add to the previous question, in how many cases does PCR return a no DNA detection result?
So I'll give you an honest answer, Tony. I don't know. I couldn't give you an exact number of how often PCR does this, but what I can tell you is PCR is extremely sensitive. We're talking a couple of copies of DNA within a sample, which is a very small amount of pathogen. In some cases, you actually hear sort of the opposite. Is it too sensitive? Because we are able to detect such a small number of pathogens. So I would actually say very rare. Yvonne I'll let Yvonne come in a second, but just quickly before he does, the reason why PCR is so good is that it needs to be extremely sensitive. It's one of the biggest perks about PCR. It enables us to, as I say, go down to very small numbers of pathogen detection. It also enables us to still be able to pick those small numbers up, even if other pathogens are in higher numbers. It's not going to hinder my more minor result, for example. And it still allows for pooling. We're still able to, in a pool of 5, be able to detect that pathogen that's in that sample. So it is highly sensitive. And I will let Yvonne though come in now about the no DNA detection result.
There's no diagnostic test that is perfect. There's no 100% sensitivity and 100% specificity, even though there's out there publications stating that. But we believe that I think there's data related to our product, and I think we are in the 98, 99% sensitivity. So we're talking about 1 or 2% misses versus a 40% from culture. So that's more or less the number.
I can say from experience, we occasionally will get those in our lab where just nothing comes back. I know what I personally advise our customers on, but what would your advice be if you got a customer that got a negative result, nothing came back on the PCR? What are the potential options why that happens, and what do you suggest they do next?
I would suggest probably in that case, if I am testing for the purpose of, I know that there's something going on in my cows, there is a mastitis issue, but yet I'm getting a no DNA detection result, I'm probably going to test again in maybe a couple of weeks' time, because I said before, the cow's trying to fight off the disease, and throughout that process we are going to be reducing the number of pathogens that are going to be within that milk sample, and it'll be slightly intermittent because they are such a small number. However, again, I would probably advise a week to 2 weeks, maybe retaking. So I don't know what you'd say, Michelle, but probably do that, and probably then we would see a positive result for the causative agent in that case. But Michelle, what would you do in that scenario?
That's one of my options that I recommend is resampling. The other one that I talk about is that we do know that there are these kind of rare pathogens out there that they're not included in the panels because they are so rare, but they do happen on occasion. So you might be one of these rare cases that you need to go and do some sort of culture at a diagnostic lab, a vet diagnostic lab that can further speciate those specific rare pathogens. But because they're rare, it's less likely that that's what it is. It's just still an option.
Yeah, absolutely. I think there are a couple I know that obviously aren't covered because they are minor species like Lactococcus and those type of things. But I think, as you said, I think my personal view would be, first off, wait a little bit of time and get her retested, and then potentially we might be in a scenario where we're thinking it's one of the more one of the less common mastitis causing pathogens that we might be looking at, and we might need to look into a different diagnostic test there.
All right, looks like we've got another one in here. It says the good news is that PCR has controls to show that the reaction worked, even if the target is negative. Very good point. Absolutely. All right. Anybody else have any other questions? Like I said, feel free to unmute yourself if you'd like to talk to us, or you can continue to type them in the chat. I can read them out.
Michelle?
Yes, go ahead.
Should high somatic cell count, if you're going to use dry cow therapy, should you go with a 3-way to be more economical, or should you be going with the 16-way mastitis test?
You're talking about which panel to use?
Yeah.
Considering
more economical for the farmers using the therapy.
Yeah. I would say it kind of depends on their herd history and what their end goal is. We know that a lot of mastitis comes more from environmental issues rather than the big contagious bugs that people know and love to talk about. And so if we are just using that, they may miss things. But if they know, for instance, that they have a Staph aureus problem or have had that problem in the past and that's the only thing they're concerned about, absolutely go ahead and do that if you just want to make sure you take care of that. But if they're just looking at setting up a very selective dry cow therapy program that's going to be a good program, a good solid program, they're probably better off going with the complete panel to make sure we catch those environmental pathogens as well.
Okay, thank you.
So another question that I had, we've kind of touched on this, but what happens if, we've talked about what happens if we get no detection. What happens if we get a whole list of things that we detected in there? We get 7 or 8 different pathogens. On a culture, that's considered contaminated sample, and they throw it out and start over again. So what do we do when we find that in a PCR test?
I missed just the end bit of that. Sorry, Michelle, could you repeat just that end bit of that question?
Oh, just that in a culture, if we detect more than one pathogen, that sample gets thrown out as contaminated and they start over again. In PCR, we don't do that. So what does somebody do if they get a result back that says they had multiple pathogens in the same animal?
Yep, so on bulks, this is something that obviously we can run into. And this is actually something that we're focusing on as a company. So we're looking into this ourselves, and we're really trying to look into what concentration we can go down to and still be picking up that pathogen correctly within a bulk sample. So watch this space, because that is something that we're also trying to answer ourselves at the moment. I don't know if, Yvonne, you want to add anything on that, but I know that is something that we're trying to ascertain.
Yeah, no, when it comes to bulks, it's really wide,
It is.
We're working on it, basically. So we're running a couple of studies. It's going to be difficult to serve.
Michelle will have to invite us back.
There you go.
Yeah. So it's going to be difficult to determine the appropriate number of animals contributing to that bulk. We might have a couple of options down the road with a little bit data, but we know that it's going to be the Wild West, right? So different sizes.
All right. And then I just wanted to point out, so while, and you guys can chime in as well, while we have a lot of information about mastitis and PCR and how to utilize it, how it can impact our treatment decisions, our management decisions, one of the biggest things that I like to push to all of my customers is how important it is to work with your local veterinarian. I am not a veterinarian myself. I am not going to prescribe a specific medication you should use or anything like that. That is something that you should absolutely be talking to your local veterinarian about. They should be setting up your treatment protocol, and this is in my opinion, just another tool to help guide that treatment protocol and that management decision, not to replace or take over anything that your vet is telling you to do. I don't know if you guys have anything to add about that.
No, totally agree, Michelle. It's a huge amount of information, and it can be extremely useful and can certainly help with your treatment protocols. But with that means interpretation and taking other factors into consideration. And that's why working with your vet with these results can really help with that. I totally agree. You have to take a holistic approach to mastitis, but PCR can really help inform some of those decisions.
Right. I think I'm just going to do another quick scan here and make sure we've covered all of the questions that have been put in here. I think so. All right. It looks like if you've got any last minute questions, feel free to throw them in there. Otherwise, we will get ready to wrap things up. Did either of you have any last minute points you wanted to make?
No, not from me. Just thank you for having us, and thank you for the great interaction. It's really nice to have so many people join and to have a good variety of questions. So thank you, everybody.
Okay, so as we wrap things up today, I just want to remind you all that if you would like more information or you're ready to get started with mastitis PCR testing, reach out to your trusted CentralStar representative. They will know what to do to get you set up. I will be sending a follow-up email to everyone that registered for this event, which will contain a link to view the recording on our YouTube channel. So this series will continue with new content quarterly. The next episode is expected to take place mid to late October. So if you would like to register now, simply respond to the email that sent you the invitation for this episode, or respond to the follow-up email you'll be receiving shortly. If you're watching this as a recording on our YouTube channel, hit the subscribe button and change your alert settings to all so you get notifications whenever we publish new content. Also, follow us on social media like Facebook and LinkedIn to see our upcoming events. And I thank you all for joining us, and we'll see you next time.
Perfect.
Thank you all.
Thanks, Michelle. Thanks, everybody.
Bye.
Thank you.